Very good afternoon to all of you. And I would like to congratulate Ms. Jinu and Dr. Asia for a comprehensive overview of diabetes and lifestyle medication. Well, your presence in this webinar is a true testimony that you are about your concern regarding your own health. And this will be the last lecture of today's event, and I hope that I will motivate you to take care of yourself in a better way, and I will motivate you to pass on this health wisdom to next generations also. So diabetic patient who knows the most and applies it lives the healthiest and longest. The information is there, but if you don't apply, it is not of much use. So we are actually drowning in information, which is available everywhere on WhatsApp and Google and social media, but searching for the real knowledge. If Google can help in treating patients, then nobody will visit the doctor. So there's a lot of vague information, and that's why we are looking for the real knowledge, which is useful for us. Knowledge without practice has no positive outcomes. So if you have knowledge and if you don't apply it, you're not going to get better with that. We say knowledge is power, but only if it is utilized optimally. Knowing and practicing are two different things. Most of the people, they know most of the things, but the application is very, very rare. So why are lifestyle diseases increasing over time? Heart disease, now we see very young people aged 30 to 40 developing heart disease, diabetes, hypertension, hyperlipidemia, and obesity, which is itself is a big problem. So why is it happening? Common reasons for rising prevalence of metabolic disorders you can see here. So what has happened over the time in 30 years? The technology has become better and better, and we have become worse and worse. Now, if you see here, in 1990s, you see the thickness of television and the individual, a human being. And now you see. Now, in early 90s and 2000, we used to pull children from out. Our parents used to call them, now it's enough playing outside, now come inside. Now the trend is reversed. We have to push our children to go out and play. So overall, there's reduced outdoor playing in last 2 decades, excess outdoor eating, easy online ordering. People have become so busy sometimes they don't want to cook, and they will order. They think that this is easier. They don't understand that what is the quality of food and how balanced is that food which they are ordering online. Then disturb work-life balance. A lot of stress related to work, long working hours. Some people, they travel a lot because of the nature of their job. Then shift duties, and then deadlines to achieve or finish, and then reduce sleep duration. So these are some common factors which have contributed to rising prevalence of metabolic disorder. Faster advancement in technology, that is keeping us busy always. We keep on getting newer and newer things, and we keep on getting occupied. And actually, the technology is for using and to make life better. But actually, we are being consumed by technology. Technology is consuming us. It is taking our precious time. It is not allowing us to think about ourselves. Then era of likes, social approval, self-image, 24/7 availability, competition, virtual image has become more important than actual image. So there are so many apps where people will beautify them and their image, anything they can put, but they are not working on their real image or actual image. So there is enough advancement in technology and treatment over last 20 years. The healthcare has improved significantly. But if you look back, there's no significant reduction in prevalence or outcome of chronic lifestyle diseases. So despite having so much of technology, so much of awareness, why are we lagging behind? Why are these diseases still increasing, and there's a projected figure that it will increase by 20 to 30% in the next 10 years? The reason behind that is the mindset. The change in mindset regarding self-care or health wisdom is lagging behind significantly. So it is the mindset which is not mindset about self-care, about their own health, or the health wisdom regarding that, is not improving at the same pace as the technology is improving. We have fixed mindset regarding many things about our habits, our superstitions, our fixations about the different things which I'll discuss. So that is the main reason that we are not able to tame these chronic diseases or metabolic diseases. Now we have two kinds of issues in our practice. One is the genetic problems where the genes play an important role. And second is the acquired. Acquired means which you get because of your faulty lifestyle and your surrounding environment. So genetic predisposition for a disease means someone in the family has diabetes, obesity, high cholesterol, or hypertension. And then you are predisposed for that. Now, the risk is higher if the number of people in family are who are affected are more. Suppose both parents are affected with diabetes, there's 80 to 90% chance that a child will develop diabetes if child is not careful about his eating habits or the lifestyle is sedentary and no exercise. Now, one thing is that we cannot change genes, but we can practice the healthy lifestyle from the beginning. Because the risk starts as soon as you are born with those genes. If your mother had diabetes when she was pregnant, she had diabetes later on. Some people, they sit back, they'll think my mother developed diabetes at the age of 60. So maybe I will get after 50 or 60. No, in next generation, the development of disease is much earlier. And that is why we see people in 30s and 40s, which is the most productive stage of life, where a person is struggling to settle down in the career, he's working hard to get the progress. Simultaneously, he's struggling at the family front also. He's expanding, he or she expanding the family. So many things are coming up at that age, and suppose the diabetes is diagnosed, it's quite a disturbance. It is affecting the mindset or the mental state of the person. And on the top of that, if there are so many myths and misconceptions which are traveling around on the social media, that actually gives more psychotrauma to these young people. So there are three kinds of wisdom which are required for balanced and successful life. You are aware of two of them, you are very familiar to two of these. This is family wisdom and financial wisdom. Family wisdom is your values, your culture, which get imparted from your parents, from your grandparents, and you follow that sincerely and religiously. The second is financial wisdom. If you have a business, if you have if you are doing some investment, you are passing that slowly to your legal hair or the children. And you are teaching them how to save money, how to spend wisely. But the most ignored and the important one, which is the health wisdom, is not getting appropriate or adequate attention. How many times you discuss with your children when you're sitting on dining table that how important is health, how they should take care of themselves? How commonly you discuss with them? No, you don't discuss with them very frequently. And that is why many people, when they become diabetic in the age of 30s and 40s, they get shocked because they were not prepared for that. And they didn't bother because nobody has told them that this may happen to you. So what is actually health wisdom? Health wisdom is an ability to understand the importance of good health and using the right information or knowledge to maintain it. It also includes the willingness to adopt newer ways and methods to change the unhealthy habits and behavior time to time. So whenever you come to know that something is going wrong in my lifestyle, you will think about it. You will accept that and you will work on changing that. You will work on improving it. It also includes a commitment of pledge to yourself to take care of yourself. Your health is actually your responsibility. It's not anybody else's responsibility. So you have to accept that you have to take care of yourself in the best possible way. Is there any relation between health wisdom or general intelligence of wisdom? Unfortunately, there's no clear relation. Health wisdom is not same as conventional wisdom. And there is serious scarcity of health wisdom in community or society, even in very qualified and educated people. And I see all kinds of people and really feel pity. When people in very good position, very highly qualified, when they are not able to take care of their health. Then I ask them, what is the importance of your education or being it is such a high position and you are not having time to take care of yourself? Where are you going to finish when you retire? What is going to happen down the line in 10 years, 20 years? Now, this is another problem in life. Health versus wealth or health and wealth. Now, what is the problem that many people, they choose first wealth over health, they ignore their health, and finally they spend this wealth on restoring their health once they lose it. So what is my opinion, or what is my request to all of you? That health and wealth should go together. Don't leave your health behind in pursuit of wealth. So get some time for yourself and take care of your health as you take care of your wealth, your career. So the problem is actually in our education system and career-based upbringing also. There's so much of focus we give to the education and career that our children, we forget to teach them about the importance of good health. We forget to teach them that the health is very important and you have to take care of it. It should not happen that when you are finishing your education, you are going to get a very good job and you are landing up with the diabetes or hypertension or heart problem. So the problem is that the position of you and your health in your life is somewhere lying down here. So career and job, family, TV, social media, they take preference. They take the top spots. So you and your health gets lost somewhere. So what is my request to all of you, that put you and your health on the top? Because if you are happy, if you are healthy, everything else will be taken care of well. You can keep people happy only when you are happy. You can continue your job happily only if you are fit and is healthy. You will be more happy to spend time with your family and friends if you're enjoying good health. And that is why there's a old proverb that health is wealth. There is a big reason behind that. And people who lose health, they understand the importance of it. So how are we going to build a strong portfolio of health? Most of you are very good in making the good portfolio of wealth and your assets. But have you ever thought about making the strong portfolio of health? So we can have a short-term portfolio in health, like trading in the stock market. So you are working for short-term gains, like quick short-term weight loss or short-term control of sugar or cholesterol. You are not thinking about long-term. So the result will also be short-term, and you will lose the benefit once you once you are stopping that, whatever you are doing to lose weight or maintaining the sugar. What we want you to do is to build a strong long-term portfolio. So working towards long-term gains through proper discipline and adopting correct practices for long-term good health. So how can you do that? By investing in health from childhood. If you have not done, please teach your children that health is very important. Passing health wisdom to our kids and future generations so they really understand, because only when we will pass this health wisdom to our future generation, we will be able to tame these chronic metabolic diseases. Because it will take at least 2 generations to practice this to show the significant impact in reducing them. Then rectifying the wrong practices and adopting the right practice. You may have learned something which was wrong, maybe 10 years, 15 years back, but don't try to impose that to your next generation. If you feel that that was wrong, accept it and try to rectify it. Because over the years, the research has progressed and then the information has improved. So we have to work on in current scenario, and we have to see that whatever is our knowledge, whether it is fitting in the current scenario or not. Now, reviewing your health and lifestyle time to time, this no, most of the people they don't do. They will just leave it. If once they stop exercise, it will take a long time for them to restart. So you have to review your health and lifestyle, and you have to see where it's going wrong and rebalance it to keep them on track. If you don't think about it, it doesn't happen. So what are the three most important things which have been governing our lives? As we say, attitude is everything. Right or positive attitude. It is not only in other things, it should be for your health also. You can apply this everywhere, but most of the time people are not applying on their health. So I want you to apply that on your health. A progressive mindset. We have people of two kinds. One is having fixed mindset, who don't want to listen, who don't want to accept the change. They are happy in what they are doing. They do not progress in life. They are left behind with time. And there are another category which is having growing mindset, a progressive mindset, in which there's an ability to mold and change yourself with time, with desire to learn new things and habits. So we want you to have a growth mindset. We want you to instill to instill this concept in your children. And third is passion. As you have passion to do your job, your work, the same passion you should carry for your health. Be passionate about your health, and then feel happy if you're doing something great about yourself. So there are three essential components of health wisdom. One is mindful eating, second is regular exercise, and third is maintaining optimal weight. The fine aspects of these have been covered by previous speakers, so I'll just go for the shorter concepts, and I will tell you how to incorporate these things in your daily life. So mindful eating, then regular exercise, any form of exercise which you like to do, and maintaining healthy weight from the beginning. It's very easy to gain weight, but it's very difficult to lose. And people who have gone through that, they are the real witness. So food and soul in our culture are inseparable. There are many reasons we eat, and there are many occasions we eat even without wanting much. So there are some people who eat to live. Some people, they eat for good health. And some, they eat to feel happy. There's a lot of social eating because of the social gathering where we tend to eat unnecessary. More the social eating was the kind of health you are going to expect. Eating in stress or depression, which is also quite common because people use food as a comfort. They feel better when they eat something which is not very healthy. Then we have a lot of celebrations and eating. So we have enough occasions to celebrate and eat. So how are we going to practice this mindful eating in such scenario? Now, if we see the evolution in human eating behavior, it has worsened over time. And you can see here that how the humans have evolved. And this was the best era when the fitness and the disease were very less. But in the last 2 decades, you see that what has become, what has happened to humans, and this is the problem. 60 to 70% people who are in UAE are overweight or obese, 60 to 70%. So we are getting more refined and processed food, which is caloric loaded. There's easy availability of junk food, and unfortunately it is cheaper than the healthier food. If you order salad in any fast food restaurant, you will find that it's costlier than a burger or a pizza. Easy online ordering. Just click the button and food will be at your doorstep. The growing trend towards eating outside, because if people are so busy, sometimes both husband and wife, so they don't have time to cook. And then excess social eating depending on their profession. So I want you to ask some common questions to yourself. Should I eat same amount of food at the age of 40s and 50s what I used to eat at the age of 25 and 30? Why do most adults start gaining weight after 30s? What is more important, it's quantity or quality of food? Do we really need to eat dessert every day? Shouldn't we stop overfeeding our children at early stage or early childhood to avoid problems? What we have seen that obesity sometimes runs in family. The same like diabetes. These are legacy diseases. They have become legacy disease. So the metabolism actually start declining after the age of 30s and 40s. So the diet has to be adjusted. It's the quality of food which we should believe in more, and we should practice more rather than the quantity. The majority of the people start gaining weight after the age of 30s because of their lifestyle becomes sedentary and they do not adjust their caloric intake, and then slowly they gain weight. And if you remember your childhood day, the dessert was for occasion. It is not a regular food. Now people want dessert every day. It is not a regular food. So what are our common fixations, our beliefs, our superstitions, which are the biggest hurdles for behavior change? Like most of the people think that they should eat a lot of bread or rice or chapati, otherwise they will become weak. You cannot eat at the age of 60 as the same as you used to eat at 30. No, your metabolism has slowed down. You have to adjust. These two people cannot eat the similar amount. They have different requirements. Again, a person who is having sedentary job and person who is laborer are very active in the field, physically active, they have different requirement. So at the different ages, different activity level. So we must adjust our intake as per our age, weight, work, and lifestyle. Then only we can maintain the good health. So another example I'll give you, that most of the people have been taught in childhood that the power of egg is in yellow. That is wrong. It is the white which is protein, which is the building block for the muscles. The yellow is having mostly cholesterol and some vitamins. So yellow can be eaten occasionally, once or twice a week. But you can eat white every day unless you are having allergy to egg. Then eggs and nuts are hard foods, so don't eat in summer. There's no such thing unless you have some individual allergic issues. As long as your body tolerates, you're habitual of eating, they are the power food actually. And you can eat them in any season. Then fruit should be eaten immediately after food. This is a very common problem. Fruits must be eaten in partially empty stomach or between two meals to derive greater benefits. When you are eating fruits with meals, actually you're not getting full benefit. It gets mixed with all the vitamin minerals with the food things and the acid and all, and you don't get the full benefit. Another problem when you eat fruits with the meal, that the fruits have natural sugar. They're not sugar free. So already you have taken the meal, and if on top of that you add the fruits, you increase the caloric load or the glucose load of that particular meal, and that will give rise to high post-meal sugar. So always try to eat fruits in partially empty stomach or in between as a snack, not as a part of your meal. Eating nuts can increase the sugar and cholesterol. No. There are good nuts like almonds, walnuts, pistachio, pecans, and hazelnuts. If you eat one handful at 1 ounce, they can increase the good cholesterol. They can protect from obesity and cardiovascular disease. They are powerful rather than using these biscuits and all these crackers and all. Try to grab nuts. They are the power food. So how are you going to do this mindful eating or wise eating? So you can eat first to tell yourself that you can eat everything, but in limits. Choose healthy option more than unhealthy. When you know something is unhealthy, take a small portion. When eating outside, practice restraint. Food is not running away from us. It is around us. We are surrounded by food. So we must know what is good and what is bad and how much to eat. We should know when to stop. There's a thin line between normal eating and overeating. If you like something, keep it. You can eat a small portion in the afternoon. You can eat in the night, but don't try to finish it at the same time. That is the problem. It's prudent to eat little less than overeat. And never go to any party or restaurant very hungry. Either have some fruit snack or some nuts so that you don't jump on food immediately when you reach there and you are not very hungry. Remember, when you are hungry, it blunts your mind's control, leading to overindulgence and overeating. So it's very important that you remember this fact. Eat slowly, enjoying each and every bite, as it gives more satiety and satisfaction. You will feel full. If you eat very fast, the satiety comes late and you tend to overeat. Now, what is the commonest reason for not doing exercise? This is the second part of health wisdom, the exercise. When I ask people in my clinic, most of the time, surprisingly, the answer is being lazy. I can, I want to, but I'm not doing. I don't have the answer also, that why I'm not doing. Sometimes as a physician, I feel really helpless. That despite motivating them, despite telling them repeatedly, they don't want to do. So I don't know. So this is the problem of the fixed mindset, which does not accept anything which is good also, but despite knowing that it is good for the health. So we want you to have a progressive mindset, growth mindset. Now another problem is diet versus exercise and diet plus exercise. There are people who think that I will do exercise, I'll eat everything and I will lose weight. No. In any good health, the contribution of diet is 80%, 70 to 80%, and exercise is 20 to 30%. So don't think that if you will eat anything and you will get away with exercise. No, these are complementary. The exercise should be coupled with healthy diet. For losing weight, there's 80% contribution of diet and 20% of exercise. The exercise helps you in maintaining the fitness and maintaining the weight you have lost. And don't be under the impression that you can eat anything at any amount if you are doing regular exercise. No, you have to practice restraint. Otherwise, you will be actually spoiling the effort of your good exercise by selecting the wrong dietary options. Now, some people think that why should I exercise? I don't have any problem. I don't have any disease. Exercise is not only for the people who have disease. It is for everyone. It is for good health. So don't perceive it as this for the sick people. Then some people think that I must go to gym or outdoor for doing proper exercise. No, it is the regularity and the consistency which is important. Whether you do it at home, you do it in your corridor, you could do it in your surrounding, in your building. I don't tell you to go to gym only. Going to gym, you need a lot of dedication and the time. If you can go, it's fine. But you will not do that, okay, I'm not going to gym, I'll not do exercise. Many people I've seen, either they will go to gym or they will not do exercise. This is not, we need consistency and regularity for the brain benefit. Then another misconception is that walking is good enough. See, walking when you are doing is isotonic exercise, as Ms. Jinu has mentioned. The problem is that you are doing the lower half of body exercise. What is happening to upper half? Diabetic patient, a metabolic problem patient, and with the age, we lose muscle mass. If you don't exercise upper portion of body, the muscle becomes soft and flabby, the contour of body changes. So it is very important that we do at least 20-25 minutes of good stretching, some light weights, whatever you can do comfortably to maintain the muscle mass of body. If the muscles are less in the body, the post-meal glucose goes up, because when you eat your meal, after that, the muscles also take up glucose to maintain it normal. So how are you going to achieve all that? So much of information came to you. How is it going to adopt it? How are you going to accept it and to put in practice? So for that, I want you to ask some common question to yourself. Why do you brush your teeth every day? Why do you take bath every day? And why do you eat your food every day on time? Because these are the practices. These are the habits which you have developed from the childhood. They were enforced on you and you have developed them and it has become part of your life. How do you learn a new gadget or app? Why are you able to learn mobile? Suppose your son or daughter is giving you a good mobile, a new fancy mobile. You're so excited. You have interest to learn. You have desire to learn. We learn in desperation also. Like in COVID-19 situation, we were homebound. So we have learned all the possible apps of communication like Teams, Zoom and all. So we learn in different scenarios. So why can't we learn the things about our health? We have a lot of peer pressure in our life about all the materialistic things, about the children education, clothes, good house, and most of the life is consumed to achieve these things. But where is the peer pressure for good health? Are doing exercise regularly or practicing mindful eating? I want you to become the role models for your family and for your friends. To maintain good health, to achieve good health, feel proud about, I want you to feel proud about yourself. That you're doing such a great thing and your people are giving you example, they get motivated. So I want you to build the peer pressure of good health, because that is going to help you in long run. So when discipline actually becomes a habit, it becomes easier to follow it. Like brushing is a discipline we have to follow. We know the benefit. It has become our habit. So same way, when we have something which we want to improve or change, we have to make it a habit. So how are you going to make discipline a habit? If you want to start exercise, if you want to do mindful eating, by doing the new thing every day for at least 21 days, because most of the time it will become your habit then after that. if you want to try something which is healthier and good, you have to try at least 17, 18 times before you say that I really don't like it. Trying once or twice, because your taste is developed from the age of 6 months when you were introduced food beyond breastfeeding. So your taste is developed from the age of 6 months. It cannot be changed in 6 days or 6 times. It needs repeated exposure for change, and the mind has to accept the change. So to develop new habit, what is important is practice, practice, practice. Without that, it cannot be done. So behavioral change is a slow process. We cannot change behavior overnight. People have hard time to change their behavior because most of the time they don't accept that they have problem. But change is an eternal truth, and behavioral change is a slow process. When you are accepting the change around you in anything, in the technology, in the construction, anywhere, you are accepting because you are forced to accept. Nobody is asking you that this change is going to happen. Should we do it or no? No, nobody is asking you. You are getting adapted to it. So same way, when you want to bring change in yourself, it needs your own permission, nobody else's permission. You have to permit yourself to bring the change in yourself. Nobody else can do on your behalf. We can just guide you, we can educate you, we can empower you, but ultimately it's you who has to do that. So there should be a need to learn to embrace the change if it is good for your health, and then you have to allow it to happen. If you keep your doors closed and you don't accept it, it will not happen. Even if I tell you 100 times, it doesn't matter. The constant effort, practice, and self-review is required to bring the change. It doesn't happen overnight. You take your time as long as you're willing to do the change. And there are different stages of behavior change. So first, when you come to know, like you understood so much of information today, you were listening, you were reading, and you were watching it. So first you have to register this new information in your mind, that what you have learned about it. Then the second is you have to put it into practice. And then you have to repeat it again and again till it becomes a habit. If you learn it, but if you don't practice it, it is not going to become a habit. So give yourself time, but you have to set a time frame also, that I'm going to do this. Write down somewhere, and then keep doing it, till you stop exerting yourself to do it. It will become automatically part of your routine. So can a person with diabetes go in remission? Can we prevent most of the complications related to diabetes? The answer is yes. If a person is newly diagnosed, if they are overweight, they lose 10 to 15 kg of weight, their lifestyle comes to up to standard, they become very disciplined, they go in remission. But remember, the remission will last as long as you are disciplined and you are continuing the change which you have adopted. The day you start losing, the day you start bringing your old wrong habits in your life, the remission will go. And this is the reason that majority of the people, they fail the remission. Most of the complication of diabetes can be prevented if we control the sugar very tightly from the beginning and you practice the optimal lifestyle. Now, what are the common misconceptions related to diabetes and cholesterol medication? Now, this is a very common problem, that if people say that once we start medication, they will become habitual. This is totally a wrong concept. When you need medication, you take it. The concept has changed over the time. Earlier, we used to wait 3 months, 6 months before we start medication. Now the concept has changed, that early aggressive control, that control your sugar and cholesterol as soon as it is diagnosed, and then we can reduce the medicine slowly. There's no such thing like you'll become habitual. You want to become habitual of diabetes, that is you are happy, but you don't want to take medicine. No, this is totally a misconception. Then diabetes medicine can spoil your kidney. This is another problem in which we are fighting for a long time. The truth is, it's uncontrolled diabetes and hypertension which affects kidney, not the medication. Nowadays, we are fortunate to have medication which actually protect the kidney. So these are community acquired myths and misconceptions which patients are taking very easily, and they are adopting it and they are relying on that information. Now, diabetes medications have a lot of side effects. I always ask my patient, the side effects of diabetes are much more than the side effects of medication. So you see, from head to foot, head to toe, as Dr. Asya has already discussed, there's so many complications. It can affect any part of body and can disable the person. The medications do not have that kind of side effects. So medicines have lesser side effects, and they can be easily managed and monitored rather than the side effects of diabetes. Another problem which we are fighting is the diabetes and the cholesterol medication. The cholesterol medicine has a lot of side effects, so don't take it. Most of the time people don't take this medication without realizing that diabetic patients have 3 to 4 times more risk of dying of heart disease. And we have a lot of young patients developing in the hospital undergoing angioplasty and bypass in 40s and all because they did not take the medication. People with diabetes are more likely to develop heart disease at a younger age. So the statins are having two effects, two benefits. The primary prevention, if somebody has not developed the heart disease or stroke, then we can prevent that. And the second is if somebody already has developed, then we can prevent the second episode. So don't play around with medication because if doctor is giving you something, it is for your own good. He has studied so much to give you the best, but if you don't trust him, it's not going to help you. With that, I would like to conclude that where there is a will, there's a way. We use all these things in our career, in our education to motivate our children, but we forget to use it in our health. So take first step towards the successful journey for great health. Make your health a priority by using health wisdom, and rest everything will be taken. If you're healthy, if you're fit, you will be able to work harder. You will be able to work efficiently. You will be more productive to the society and your family. Pass on your health wisdom to future generations, then only we will be able to prevent the spread of pandemics of diabetes, obesity, and CVD. And remember, this will take education of 2 generations till this is applied. Otherwise, we are going to face more and more increase in these problems. So I want you to remember that you have only one life to live, enjoy, and take care of. So balance it in such a way that you don't compromise one because of other. And your health has to be given a sufficient priority so that you can do justice with all the other things. So people think that, oh, we have one life, okay, we'll eat this, that, and that. The problem is that when you suffer, you're in the hospital, somebody's toe is amputated, somebody becomes blind, somebody is having kidney disease, then you realize the importance of it. But then it is too late. The complications in diabetes can be prevented, but may not be reversed every time. So we are working towards the prevention. We don't want any of our patients to suffer with any of these complications because after that the life changes. So thank you very much for your patient listening. And I would just like to finish with that the cost of discipline is lesser than pain of regret. And discipline is actually the bridge between goals and accomplishment. Remember, you are the captain of your ship and your life is your ship. We are the lighthouse. We are just going to show you the direction. But you have to go in the right direction. Being a captain, you have to take your life to the right direction. Thank you very much for your patient listening, and would like to take some question and answer now.